So good afternoon, ma'am. My name is Bianca Isabel Odiaman, your student nurse for today. So today I'll be performing a return demonstrations on skin, hair, and nails. So first, I will wash my hand and wear my appropriate PPE such as my mask and my gloves. Now, after doing my PPEs, now I'll provide the patient's privacy by closing the doors, curtains, and windows. Now, I will explain the procedure to the patients. So, good afternoon, ma'am. My name is Bianca Isabel Odiaman, your student nurse for today. So, today, ma'am, I'll be assessing your skin, hair, and nails. So, these will be included checking and other parts of your body that involve for the inspection will be exposed. But don't worry, ma'am, it won't be taking so long. Is that okay with you, ma'am?
Yes, it's okay.
Okay, so before we start, ma'am, may I ask your birth name or birthday and name?
My name is Julia Samantha Pacificador and my birthday is May 15, 2000.
Okay, so now I will start by obtaining the subjective data. So first, ma'am, have you noticed any changes on your skin, hair, and nails?
So far, ma'am, none.
Okay, so have you any noticed itchiness or problem on your hair or scalp?
No, ma'am.
Okay, so ma'am, there is a time of hair loss or scalp problem.
So far, ma'am, none.
Okay, how about your nails, ma'am? Any changes?
No, all good, ma'am. My nails is all good.
Okay, so now I will be start assessing the patient. So first, we're gonna do or start the skin assessment. So first, ma'am, I'll be checking and inspect for your unusual odor. So as I can see and smell, no unusual odor noted. Next, I'll inspect for the color variations and breakdown or lesions on your skin. So as I can see, ma'am, your skin is fair white, no variations, no skin breakdown noted. Next, I will be palpating your skin, ma'am, for us to check for the moisture, skin textures, and your temperatures. Okay, so your skin is warm. Your skin is also smooth. There's no any signs of dryness, and your skin is also not thick at all. So next, I will be assessing the skin turgor to the patients and check for the signs of turgor or edema. So ma'am, I'll be pinching your skin. So but don't worry, ma'am, it won't be hurt. For us to check for the sign of edema. Okay, your skin eventually back to normal. So it is good. Your turgor is good, no signs of edema at all. So next, I'll be assessing the hair and scalp. So ma'am, I'll be inspecting your hair color and distributions of your hair. So next, I'll palpate your hair, ma'am, to check for your scalp and the texture, oiliness, or any parasites noted. So as I can see, ma'am, your hair is eventually distributed. Your scalp is clean. There's no signs of parasite at all, which is good. So now I'll be now proceeding for the nails. So for the nails, I'll be checking for the nails for the cleanliness, shape, and colors and markings. So ma'am, can I see your nails, ma'am? Okay, your nails are clean, well shaped, and markings. So I will now palpate, ma'am, for the texture and the consistency. So as I can see, ma'am, your skin is, the texture of your nails rather is smooth and which is okay, and the consistency is normal at all. Now I will check for the or test for the capillary refill. So ma'am, I'll be checking for the capillary refill to check if how many seconds the capillary refill will be back. So I'll be pinching your nails, ma'am. Okay, your capillary refill is back within 2 seconds, which is normal at all. So now, ma'am, I'll be discussing the A, B, C, D, E of cancer. So this, ma'am, the A, B, C, D, E is the signs of the skin cancer. So A for the asymmetry, B for the border irregularity, and C for the color irregulations, and D for diameter, and for E is for evolving lesions. So ma'am, I'll be teaching you now for the checking your skin assessment by yourself. So ma'am, for you to check your skin, this will be required us to check your self and your skin as well. I think for like every week or even once a month. So when you're at home, you can check yourself by in the mirror. In the front, checking your skin if there are any changes or you'll notice in your body. While on your back, ma'am, you can use a small mirror to check for the back. And for if you notice any particular changing on your skin, you can report to us. So now I'll be wash my hands and remove my PPEs and wash my hands. So now I'll document all the assessments and report to the particular doctors assigned to me. So the patient's finding will be put on the charts and will be not disclosed. That's all. Thank you.